My name's Dr. Vivian Cox. I'm an HIV-TB doctor in South Africa. Antimicrobial resistance is absolutely a growing global healthcare threat, and at the heart of that is drug-resistant tuberculosis. I could certainly quote the millions of dollars that we spend on drug-resistant TB, but at the crux of it, one patient dies of TB every 18 seconds. And that rate won't slow down if we don't pay close attention to drug-resistant TB and antimicrobial resistance. I feel strongly that we don't have the drugs that we need to treat MDR and XDR effectively. We have drugs, but we're often choosing drugs that patients can barely tolerate due to the side effect profile. The treatment is very long. It can be up to 2 years. We oftentimes require patients to come to the clinic every day for those 2 years. Certainly not every patient completes their course of treatment for drug-resistant tuberculosis. The most profoundly tragic reason they don't finish their treatment is that they die before they have completed it. They might get diagnosed late, they might not tolerate the treatment very well, they might have severe co-infections like HIV. It's critically important that we expand access to the newer drugs used to treat DRTB, bedaquiline and delaminid. First of all, they're very well tolerated. The side effect profile is much better than the older, more toxic drugs. Secondly, they're safe. We have ongoing safety data from programmatic use of the drugs that shows we needn't be afraid of them and their side effect profile. To combat tuberculosis, the world needs to ensure we have ongoing, sustained political will to fight TB and to keep it at the center of attention. Similarly, we need ongoing funding, and this is committed, sustained increases in funding for research into new drugs, new regimens, and better models of care for our patients. And then lastly, as clinicians, we need to remind ourselves not to be afraid and to be bold, to get new drugs to our patients, to try new regimens, to support them in their treatment journey. So that might seem like a long list of serious, insurmountable challenges, but I have great hope. We are at a turning point in the fight against TB. We have new drugs, potentially shorter regimens, and we have an army of dedicated clinicians, policymakers, and researchers that together will win the fight against TB.